Welcome to OneMDHealth, where science meets soul. In this episode, we are going to discuss hormones. We're going to talk about hormones, how they're not the enemy, but it's just about understanding your biology and transitioning into midlife. So I wanted to really have a lot of information here for you about hormones because I feel this is a very heavy topic right now, especially in women's health, which is what we're really going to mainly address in this episode today. So let's talk about the famous PM words, perimenopause and menopause. So let's talk about what perimenopause means. Perimenopause is a transition into menopause that most women go through, usually in their late 40s up to 50s. Sometimes it can happen in early 30s, late 30s as well, which I have seen in the clinic. Now, here's the thing with perimenopause. It is a time when females' hormones are transitioning and into later life. And eventually, as they are depleted, we enter menopause. Menopause definition is 1 year of not having any more periods. So when you hit the 1 year mark, not having any more periods, you are in menopause. Now, sometimes when we transition into menopause from perimenopause, they may not have a period for 4 to 6 months. Then they'll have a long period after 4 months, 6 months. Are you still in perimenopause? Yeah, kind of. It's really the 1 year when you really have no periods for a year is the definition. Now, what I want to address really is there's so much on this topic on Instagram, on TikTok, on Facebook, and it's really important to know the sources that you are listening about perimenopause. I feel everybody blames hormones, especially us women. Oh, I'm getting older. I'm having aches and pains. I'm not sleeping at night. I'm gaining weight. Oh, it's my hormones. I'm in perimenopause. Though that's not always true. And this is where functional medicine comes in. And this is where being with the right clinician that can guide women this day and age. Perimenopause is not just about giving hormones. It's about addressing root cause of why you are feeling fatigued, why you are not sleeping, why do you have joint aches and pains? Why are you waking up in the middle of the night with hot flashes? Why are you irritable, yelling at your kids all the time, or hating your husband? Hey, just saying. Point is, we got to figure out the root cause. The root cause has a lot to do with gut health, nutrition, and yes, hormones, but also liver support. But hormones are always last because if you do not address gut health, if you do not address nutrition, if you do not address your environment, all right, if you do not address liver support, then hormones are going to work in a toxic environment, and that's when they are all over the place. So it's not about blaming the hormones. It's more about what is going on in these 4 areas that we just addressed. So that is the definition, real definition of perimenopause. But it goes further than just hormones. I want you to think of perimenopause as that your body is not failing, it's transitioning. And what I mean by that is transitioning into a different way of life. And as women, as we age, we are usually transitioning during this age. Have you ever looked at it like that, spiritually? Usually when our hormones start to go back and forth and adjust and start doing their own thing. Usually in late 30s, early 40s, we are transitioning. Our kids are getting older. Maybe we're changing careers, changing jobs. Maybe we are changing relationships. And so how do you expect your biological clock to not change inside as well if your environment is changing outward? So it's about, again, coming back to yourself, understanding yourself as a whole person. And a lot of times, these are clues of why things are changing. So that's my definition of perimenopause. It's not about just looking at hormones. It's about looking at the root cause. So on that note, let's talk about hormones. So when we do talk about perimenopause, what hormones exactly are we talking about? Well, I will list them for you. We are talking about estrogen, progesterone, testosterone, and yes, we are also talking about thyroid, and cortisol. Those last two are always missed because stress definitely causes, I wouldn't say maybe cause, but can put you into perimenopause earlier if you do not know how to handle it properly. So that's where cortisol and thyroid plays a huge role. So let's talk about estrogen. So what is estrogen? Estrogen is a hormone that females make in the ovaries, and that is usually in our reproductive years. There are 3 forms of estrogen that our bodies make. The first form is estradiol. That is our most active reproductive form where we feel vibrant, and the form that is very important for everything in our body, including cardiovascular health, gut health, hair, skin, and nails, reproductive health, and brain health. So as you can see, estrogen is a lot more than just fertility and reproductive years. Estrogen has a lot to do with cardiovascular health, bone health, brain health, hair, skin, and nails, gut health. Did you know estrogen is extremely important for gut health? It helps regulate gut motility. It helps regulate our gut lining. We actually have a microbiome called the estrobolome that is very important for estrogen excretion out of our body when we don't need estrogen anymore. And that's going to play a big role in perimenopause. And this is where perimenopause and gut health are very important and how they are linked. And it's exactly the reason why I address that when I'm with my patient. It's not just about hormones, it's about gut health. So let's move on. So we talked about estradiol, how important that is. Second type of estrogen that your body makes is estrone. That is made in fat cells. Estrone is elevated when usually in menopause. That's when we have increased fat around the belly, increased visceral fat, and increased inflammation. We don't really want a lot of estrone in our body. Then we have the third one, estriol. Estriol is usually made in pregnancy, in reproductive years. But the main one we look at in labs is estradiol. Estradiol ranges are very important during our menstrual cycle. Now, what I want to give a takeaway here is when I start my patients, if they ever need it, on hormone replacement therapy, aka HRT, I'm not trying to get you into a range where you were back 20, 25 years old. That's not the purpose of being on HRT. Being on HRT in midlife is just about having your metabolism work for you again, having your biology work for you again, giving you enough estrogen so that you could sleep well at night, so that you can function in the day without fatigue, so that you can maintain your hair, skin, and nails the way you want to, so that you don't have brain fog in the day, so that you're able to exercise and work out without excruciating joint pain and not suffer arthritis, and so that your gut works well and that you're able to excrete any toxins that don't belong into your body. And also that you don't get mad at your partner every night. That's just added fun there too, okay? So this is why estrogen is very important. It's more than just about reproduction. And this is why HRT is important. So now let's address progesterone. So what's progesterone? Well, progesterone has a lot to do with ovulation, and that's where it is made after ovulation. Days 5 to 7 after ovulation in your menstrual cycle, whatever that may be, from day 19 to 21. That's where it is. Now, here's the thing. If you don't ovulate, you don't make progesterone. But here's the funny thing. You don't have to ovulate every month, and progesterone can be made, and sometimes it's not made. The idea is to have enough progesterone to combat estrogen. So this is where perimenopause comes in. Estrogen starts to slowly decline during perimenopause, during the time of late 30s, early 40s. What happens is then estrogen is not tamed. So progesterone tames estrogen. Progesterone's role is calming estrogen, helps with sleep, helps with overall helping anxiety, and brain health and brain fog. So progesterone and estrogen have to have a harmonious rhythm. And in perimenopause, that's when things start to decline. That's when estrogen starts to do its own thing and progesterone cannot tame it. So a lot of times, it's not so much that your body's making so much estrogen, it's just the fact that your progesterone is declining and not keeping up with even normal levels of estrogen. So this is where, again, HRT is very important, and being with a medical provider that understands your biology and how you make estrogen progesterone uniquely. Not every woman has the same type of ovulatory cycles. Some women ovulate different months, some women don't ovulate at all. And that's where precise testing is very important for these hormones. So that's progesterone's role, which is extremely important. That explains, as we lose progesterone in our early years, our first symptoms in perimenopause are a lot of like, why am I irritable all of a sudden? Why do I feel antsy? Why am I angry? Why am I waking up mad? Oh, it's because I didn't sleep well last night. That's when it starts to hit you a little bit. I'm having tired and fatigued and I don't feel fulfilled. Like something is just off. Those are usually the signs. Then you then start to notice sometimes as estrogen is not being tamed by progesterone, that's when you could notice the heavy periods, the breast tenderness. And then slowly loss of libido starts to happen. So as you can see, every symptom has its reasoning, but not every woman gets every symptom. And again, that's why healthcare, medical care needs to be personal, especially during midlife. So now let's talk about testosterone. Have you ever heard all going around, women don't need testosterone? It's just a male hormone. Why are women worried about testosterone? I don't believe medical doctors are giving testosterone in women. I mean, do they want them to grow a beard? Are they going to grow a penis? This is all I've heard of. I'm going to lose my hair. My voice is going to change. No, not exactly. Sorry. First of all, it depends on how much testosterone you give a woman. And that's where a medical doctor comes in who understands dosing and when to give it. I don't always give testosterone to all my female patients who have low testosterone levels because I first address gut health, nutrition, inflammatory markers, liver health, and all the other hormones before. So again, it is about going to a medical professional that understands how all of these systems work together. It's not just about, oh, your testosterone's low, let's give you some. That is not how it works. It's about really understanding your biology. Then you might grow a beard. No, I don't think you will. For all my female patients, I promise I will not have you grow a beard, okay? Here's the thing though. Testosterone is very important for women as much as it is for men. The difference lies in the dosage. Men need testosterone at a higher dose. Women need it at a certain amount dose. Now, again, the amount of testosterone every female needs will vary because your biology is very different from another female's biology. So that's why you have to come to a medical doctor that understands this physiology. It doesn't treat you like, oh, well, you should be here. You should be here. No. How do you feel on this level? Where are you at on this level? It's about finding your reference range of where you feel comfortable. Now, are there certain levels that are dangerous? Absolutely. But usually there are certain ranges where some females feel more comfortable of what level to be at. So testosterone is extremely important because it's our vitality hormone. It helps with heart health, cardiovascular health as well, along with estrogen. It helps with libido, but so does everything else help with libido, okay? It helps with muscle strength training. You ever noticed why you don't feel like you're getting much out of your workouts? Could it be testosterone? Could it be estrogen? Could it be progesterone? Could be really all three. So that's why it's very important to understand that these hormones have to work together in harmony as a unit. It's not about treating one over the other. It's about looking at your whole body as a whole, as a unit, as one. Mind, body, and soul. Now, let's talk about thyroid. All right. Where does thyroid fit in all this? Well, thyroid fits in with gut health. Thyroid is important for our homeostasis of our body, okay? Helps with our energy levels. It helps with our overall vitality as well. It's almost to the point where we need thyroid to function properly. What I find a lot in my perimenopausal patients or my women in midlife is that thyroid is suboptimal. You're not hypothyroid and you're not hyperthyroid. You're in this gray area of what I call subclinical hypothyroidism. Subclinical hypothyroidism is when you don't need to be on medication, but there is something not working properly. So thyroid and gut health are very important. So when your gut is out of balance, usually around in midlife as we deal with stress, life changes, kids, everything, then thyroid starts to fall a little bit. Our body starts to conserve the thyroid hormone we make and not allow us to release it the way we want to, in layman terms. So in functional medicine, we dive deeper into thyroid health along with all these hormones because everything has to work together as a unit. Last but not least, let's talk about cortisol. Oh, cortisol does get a bad rep. Oh, my cortisol is working well. That's why I'm stressed out all the time. It's why I hate my life, and it's all about cortisol. Well, how are you going to get out of bed if you don't have enough cortisol? Got to be able to get out of bed to have enough cortisol. Cortisol is just there so that you can function properly because it's dealing with the hormones falling. You didn't have cortisol, you wouldn't be able to get out of bed. You would watch your energy tank. But it's important to balance that hormone by first balancing all the other hormones. Cortisol is a very important stress hormone because when it is out of balance, when it is elevated, yes, it can lead to high blood sugar, which can lead to insulin resistance, which is very important for estrogen to tame as well, okay? And testosterone as well. So estrogen, testosterone, and cortisol are all very important for insulin sensitivity because we don't have insulin sensitivity. We get into insulin resistance, leading our path down to prediabetes. So as you can see, HRT is very life-changing, and it's actually also important for saving lives. It can help prevent cardiovascular disease, stroke. It can prevent diabetes and obesity, believe it or not. That sudden weight gain in midlife for females, why is that happening? Is it my hormones? Yeah, but it's also diet, lifestyle, liver health, biology, gut health. You cannot treat perimenopause without addressing the gut. And I will always say that time and time again. Because if you cannot keep your gut in balance in order to excrete excess hormones that don't belong in your system, they will get recycled back into your bloodstream. And that's where you'll feel worsening symptoms of perimenopause. So my takeaway of all this is you have to look at your body as a whole. Do not blame hormones. Do not blame anyone. Really understand and shift your mindset that my body is changing and I'm transitioning. Whatever worked for me when I was in my 20s and 30s will probably not work for me in my 40s and 50s and 60s. And also, it's really important to understand during this time, whatever changes I make midlife, 30s, 40s, is going to help me thrive in my 50s, 60s, and 70s. And this is why I stress that no amount of money, no amount of material things will ever replace your health when you age in your 50s, 60s, and 70s. So please get the proper workup done now when these symptoms start to occur, and make sure that you are an advocate of your health and start incorporating lifestyle changes first, then incorporating supplements where it's needed by a healthcare professional. And then we think about HRT. Lots of times, most patients that come and see me, a lot of times I don't even need to do HRT on them. They just needed their gut to be healed so that their gut can absorb nutrients to make their cells healthier and excrete any excess estrogen or any other hormones that don't need to be there. Again, hormones, will thrive in a non-toxic environment, which is in your body. So heal your gut, fix your nutrient deficiencies, support your liver, protect your sleep, be around people that love and support you, and then we'll talk about HRT. So that is my advice for women feeling not seen in the healthcare industry. Be an advocate for your health. Listen to your body. Listen to your mind. You know what's best. Go to an accredited medical professional that understands that you cannot have one without the other. So let's stop chasing symptoms. Let's stop putting on Band-Aids, and let's address the root cause. Thank you. Thank you for visiting OneMDHealth podcast. Please like and subscribe. If this podcast resonates with you, please share it to whomever you feel would benefit from this. If you have any questions, please visit my website, SamiyaHashmiMD.com.